Are you unhappy with the appearance of your lower lid area, what's referred to as the tear trough region? I'm Dr. Dominic, and I'm going to talk to you today about treating that area to improve its appearance. And we're going to talk about two options, namely fillers versus doing something surgically, such as a lower lid blepharoplasty. So what does aging look like in the under eye area known as the tear trough? The area we're referring to is right below the lower lids, where the lower lid meets the cheek junction. You have to understand the anatomy of that area is a little bit tricky, which is the reason why people can have a, quote, tired appearance. Part of the dilemma is where the skin meets the lower lid junction, it thins out significantly. And then there's a very small ligament that helps to adhere the skin to that junction of bone. And that's why many times it starts to look aged as we get older. In addition, there can be points of swelling. For instance, if you have significant allergies, it can also just be something inherent with your genetics and your anatomy. And this can lead to a darker color. The other component that can contribute to having that tired look is as the lower lid starts to age, the support system begins to weaken. And there is fat that surrounds the eye, and that fat is always pushing on the lower lid skin. Over time, as things begin to weaken, the lid starts to herniate forward. When that happens, it can lead to significant shadowing and also having that tired look. So let's go back to talking about the options to address. So how do you treat the under eye area with fillers? The first one, which is the non-invasive route, is utilizing fillers to essentially camouflage that depression. It is something that can be done. However, you have to understand that utilizing fillers to this region can be a bit tricky. The fillers that I would recommend anybody to ever use in that area would be what are called hyaluronic acid fillers. There's multiple brands out there that are utilized, but the hyaluronic acid fillers are the best option. One reason is because if you don't like the way it looks, it can be dissolved. The second reason is the fillers, because they're more like a jelly and it's clear, you can massage the area at the time of your treatment as well as afterwards to help it flatten out and look a bit smoother. Now realize with these fillers, you make sure that whomever is doing your treatment has experience doing it and they have the ability to dissolve it if you do not like it. The reason why I say it can be tricky is because you're really trying to essentially separate the skin from that ligament and bone, and technically you really don't separate it, but you're just trying to smooth that trough out, and that's why it has what's called the tear trough look. Now, one of the problems that can occur when utilizing the filler is if you don't use the correct filler, you can get what's called a Tyndall effect, where the filler draws in fluid. It can give this area a bluish hue or discoloration. If that happens, then my advice would be to go ahead and get it dissolved. So how do you treat the lower lid area with a lower lid blepharoplasty? If you want to address the problem associated with aging, namely, as the lower lid skin starts to become a bit lax and you start to get the rhyted formation, and in addition you have the fat herniating forward, and you want a more permanent option, that's where the surgery, what's called a lower lid blepharoplasty, can be done. Now, there are two ways to do a lower lid blepharoplasty. One is through what's called a transcutaneous approach, where as the name sounds, you make an incision below the lower lid skin, or what's called a transconjunctival approach. And with a transconjunctival approach, you make an incision behind the lid and go through the conjunctiva. Now, both procedures have their pluses and minuses, but today I'm going to focus on the transconjunctival approach because this is my preferred method of choice. With the transconjunctival approach, you can use what's called bovie cautery or a laser. My preferred approach is utilizing a laser. And essentially what you do is you make an incision in that lower lid conjunctiva, which is the mucosa of the lower lid eye, and you basically are removing the fat to reduce the herniation on the lid. By doing so, it helps to decrease that pressure that's on the lid and causing it to come forward and create that shadowing. And normally you'll remove the fat from the different compartments. And then the beauty of the procedure is that there's no incision on the lower lid skin, and it doesn't disrupt the support mechanism for the lower lid and prevents problems such as changing the shape of the eye and also leading to possible pulling down the lower lid. Now, the second component to the treatment of the lower lid with aging is to utilize laser resurfacing. And your options are going to be either erbium YAG laser resurfacing, which is my preferred method, or the CO2 laser. And by utilizing the laser, you can address the skin laxity, improve the texture and appearance, and that helps to complement the removal of the fat. So to kind of recap, the benefit of using the fillers is that it's non-surgical. The downtime should be relatively minimal with the procedure. However, realize that if you don't like the way it looks, it could linger for several months unless you get it dissolved. And with the fillers, you do need to get a treatment done again as the filler starts to go away. Compared with the surgery, obviously you need anesthesia. It is a surgical procedure. It does require more downtime, but in the long run, you're going to get a more longer-term result. It does help to not only improve the herniation forward, but also helps improve the skin texture. So really, deciding which procedure is best for you is really up to you as the patient. I think just discuss this with your provider who's going to be providing your care to really discuss which direction you want to go.